Hello, I am Dr. Pralhad Prabhudesai. I am consultant pulmonary physician practicing at Lilavati Hospital. We are going to talk to you regarding tobacco and COPD. You are all aware that tobacco is in various forms one can get lung diseases. One is in the form of cigarettes, pipes, cigar, bidi, vaping and hookah. Tobacco also can be taken in the form of chewing, which gives local oral, esophageal, stomach diseases. COPD is because of the inhalation of tobacco. Various thousands of particulates, gases, chemicals, radioactive materials are there. But most important disease which we are going to talk is COPD. It's called chronic obstructive pulmonary disease. Smoking causes changes in the windpipe. The secretions which are generally thin become thick. There is a recurrent damage to the cilia which are the protective for getting infections and removing dust particles from the lung. This causes bronchitis, inflammation of the windpipe. When it goes into the alveoli, it causes destruction of the alveoli. What is the term is called emphysema, which is permanent damage to the lung. It also affects the lung capillaries where gas exchange happens, where oxygen enters into the blood. So all these areas, there is an inflammation. So this is an inflammatory disorder of the lung. This inflammation doesn't remain only to the lung, but it goes into the system, leading to systemic manifestations of COPD, that is osteoporosis, cardiovascular diseases, depression, anxiety, muscle involvement and so many things. So what is very important is that we have to prevent patients getting smoking COPD by smoking cessation. It's important for patients as well as the normal who are non-smokers, because smoking causes direct injury to the person who inhales the smoke. But there is a passive smoking, second-hand smoke it is called, can also give similar disease to the people who are not smoking. Remember, there is something called third-hand smoke. When person does, the particles which are there, which contains same whatever we are inhaling, can be inhaled or can be swallowed and can go to the lung by the hands of the person who is staying in the same room. So this is called third-hand smoking. So what is important in smoking cessation? That it's a social disease. And hence we should do our level best to smoker to help him to quit smoking. What is very important for that? Step number 1 is education. Step number 2 is individual approach to the patient. Third important thing is behavioral therapy after understanding his behavioral habits. Fourth is nicotine replacement. Yes, these are addictions, so nicotine replacement helps. Fifth, pharmacological drugs. And sixth is motivating approach, motivations to the patient and maybe showing motivational videos, etc., so that he can stop smoking.